Good morning, everyone. Welcome to the Tuesday, February 20th meeting of the Human Services Committee. I'm going to convene the meeting at 10:03 and then open it up to remarks. Senator Lesser.
Great to be back with everybody. This should be hopefully a short and sweet meeting, and we'll proceed through bills to raise.
Wonderful. Senator Seminara, any opening remarks?
Good morning. Happy to be here. I hope everybody had an enjoyable day off yesterday.
And Representative Case.
Good morning. A nice long meeting coming. Let's get going.
All right. Wonderful. As always in this building, folks have multiple meetings, and so people are going to be in and out, and so we will hold the votes open. I'll let folks know till what time as we proceed. All right, so moving on to item Roman numeral 3 on the agenda, concepts to be raised. Number 1, an act concerning Medicaid funding for reserve beds at chronic disease hospitals. Do I have a motion?
So moved.
So moved. Second by
right.
Representative Dathan.
Thank you. Moved by Senator Lesser, seconded by Representative Dathan.
Madam Chair,
Yes,
I guess we can start a consent calendar.
wonderful. All right,
Can we add number 1 as the first consentable item?
any objection? Seeing none, we'll move number 1 to the consent calendar. All right, number 2, an act establishing a task force to study the need for adult changing tables in public facilities. Do I have a motion?
So moved.
Is there a second?
Second, Representative Dathan.
All right, moved by Senator Lesser, seconded by Representative Dathan. This bill was brought to us by a colleague, Senator Kissel. There are 5 states to date who have done this. At this point in time, we thought it would be best to do a task force to understand how best we could move forward. This would be, for example, for someone who has a disability and would need an adult changing table. This would be looking to see how we could provide those in public facilities. Any discussion? Yes, Representative Mastro Francesco.
Thank you, Madam Chair. So number 2, I understand that it's just a task force, but anything that's really going to mandate something for a business, even if, as I did read some of the notes, it's even new construction, I certainly can't support. It's not, I don't even want to hear the conversation. I think that if a business wants to accommodate people, certainly they're more than welcome to do that. And if they don't, and people don't want to go into their business, they don't have to, because they don't have those accommodations. To me, this is clearly a path for a mandate on businesses. And I think maybe is it just new construction? I don't know what the language is, but in any event, it's certainly going to be a mandate on a business, and I can't support it today. Thank you.
Thank you, Representative. Any additional conversation or questions? All right, seeing none, would the clerk please call the roll?
Senator Lesser,
Senator Lesser, aye.
Representative Gilchrist,
Yes.
Senator Seminara,
Yes.
Representative Case.
Yes.
Senator Gaston, Representative Dathan,
Representative Dathan votes yes.
Senator Marr,
Senator Marr votes yes.
Representative Butler, Representative Comey, Representative Cook, Representative Fortier,
Representative Fortier votes yes.
Representative Heffernan,
Representative Heffernan votes yes.
Representative Hughes, Representative Johnson, Representative Kitt,
Representative Kitt votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro,
Yes.
Representative Mastro Francesco,
No.
Representative Pizzuto, Representative Paletta. Thank you.
Thank you, Madam Clerk. As I said at the start of the meeting, we will hold the votes open. Moving to item 3 on the agenda, an act concerning the Department of Social Services efficiency in making Medicaid determinations and responding to call wait times. Do I have a motion?
So moved.
Is there a second? Moved by Senator Lesser, seconded by Representative Heffernan. This bill, the title kind of speaks for itself, but would look at the issues that folks are experiencing with Medicaid determination wait times, and also with call wait times. Any conversation or questions?
Madam Chair, I say we move this to the consent calendar, please.
All right. Wonderful. Any opposition? Seeing none, we'll move item number 3 to the consent calendar. Moving on to item number 4, an act concerning a working group to study expanding Husky health benefits to all persons under the age of 19. Do I have a motion?
So moved.
Is there a second?
Second.
Moved by Senator Lesser, seconded by Representative Kit. Representative Kit, could I ask you to speak on this?
Sure. There are currently roughly 20,000 children in the state of Connecticut who do not have health insurance. And research shows that when kids don't have access to health insurance, they don't have access to standards of healthcare and are less healthy. And children who do have access to healthcare and regular health screenings are more likely to succeed in school, graduate high school, have higher incomes, more likely to attend college, and have greater earning over their lifetime. And it also will help by expanding Husky to all children. It will help working families. It will help ease the benefit cliff of families who are unable to accept a raise or even take on a new job because they fear losing the health benefits for their children. We all know how much more expensive a family health plan is for a working family. That'll free up income to help deal with housing costs, food costs, transportation. So this would just be a study to look at the financial impacts broadly for the state in expanding Husky to all children under the age of 19, and to look at the cost benefits, because yes, it will be expensive, but also there are long-term savings for the state. Thank you.
Great. Thank you, Representative Kit. Yes, Representative Master Francesco.
Thank you, Madam Chair. Just one quick question on here. It's for, you had mentioned that it's for all children under the age of 19. What does that mean? Every child in the state of Connecticut, whether they're a citizen or not, would fall under that umbrella?
That is one thing to look at. We can look at both undocumented children as well as children who are citizens. But as we all know, disease and poverty doesn't really understand citizenship. So.
Understand. Thank you for that answer. Thank you.
Any further questions or comments? Yes, Representative Case.
Just a quick question to the proponent. So the 20,000 you mentioned, is that 20,000 residents of the state of Connecticut children? Because I've never heard that large statistic before.
I think it was out of Georgetown. It was 20,000 children. They didn't specify whether residents or citizens or undocumented.
Okay, thank you.
Thank you. Any further comments or questions? All right, seeing none, would the clerk please call the roll?
Senator Lesser,
Senator Lesser, yes.
Representative Gilchrist,
Yes.
Senator Seminara,
No.
Representative Case,
No.
Senator Gaston, Representative Dathan,
Representative Dathan votes yes.
Senator Marr,
Senator Marr votes yes.
Representative Butler, Representative Comey, Representative Cook, Representative Fortier,
Representative Fortier votes yes.
Representative Heffernan,
Representative Heffernan votes yes.
Representative Hughes, Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kit votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
No.
Representative Ferraro,
No.
Representative Mastro Francesco,
No.
Representative Pizzuto, Representative Paletta. Thank you.
Thank you, Madam Clerk. Next up, number 5, an act concerning mental health services for young children and their caregivers. Do I have a motion? Is there a second? Moved by Senator Lesser, seconded by Senator Marr. This proposal came to us from the Office of the Child Advocate, and this would provide immediate support to sustain current treatment models for young children and their families and maximize federal funding streams to ensure a continuum of mental health treatment services here in the state. Any comments or questions? Yes, Representative Master Francesca.
Thank you, Madam Chair. So this particular concept, I remember, I think it was last year or the year before, we did pass a big mental health services bill. And I have not seen any data on that and how it's working. What is the difference between that we passed and then this one here? What will be, is there anything different on it, or is it an expansion, or can you give me a little bit more detail?
I believe this follows up on that work, and this would look to see how we can maximize the federal funding streams that do fall in the purview of this committee with the mental health services. Now, based out of the work that that group has done, I think that's one of the areas they have asked for further information on.
Okay, good. Thank you. I'll be certainly want to hear that conversation. Thank you.
Great. You're welcome. Senator Seminara.
I was just going to say this could be added to the consent calendar.
Fantastic. Seeing no opposition, item number 5 will be added to the consent calendar. Moving on to item number 6, an act concerning Medicaid for room and board costs for inpatient substance abuse treatment. Do I have a motion? Is there a second? Great. Moved by Senator Lesser, seconded by Senator Marr. This came to us as well from some colleagues. Currently, it is our understanding that Medicaid pays for treatment at inpatient substance abuse programs, but not for room and board. And that is preventing some entities from being able to open. And so this would allow for Medicaid to cover the room and board costs as well. Any questions or comments? Yes, Representative Master Francesca, sorry.
I thought it was my understanding now, just from talking to people, that when somebody does go into treatment for substance abuse, most of that bill is paid for. You're saying it's because it's just Medicaid is not paying for it, covering part of that?
I can't speak to the non-Medicaid. What this bill currently, it is my understanding that Medicaid only pays for the treatment portion of someone at an inpatient substance abuse program and not for the room and board. And so there are facilities who cannot financially sustain that model without Medicaid covering the room and board as well.
Right. Just a quick comment. It's very interesting. I read an article in the paper this morning about Medicaid and the reimbursement rates to the hospitals, the doctors, and the facilities. And they're struggling already to get that reimbursement rate. And it's really concerning that the quality of care, obviously, in our physicians' offices and the hospitals, are going down because they just, they don't want to refuse anybody. And I'm not sure if the funding, we just keep adding to more Medicaid. So when you do that, obviously, I think we are lowering the quality of care. There has to be some sort of a solution to fix the problem. The more Medicaid that you're adding to that, it's going to, you're going to have services that doctors they can't sustain it. They can't stay in business, in other words, because they can't afford it. So I'm willing to listen to this just to hear the debate on it. Not certain that it's something I might cover going forward, but I certainly would like to hear the debate. Thank you.
Great, thank you. And I'd flag for you last week, we did raise the an act concerning Medicaid rates. And this Thursday for folks, the first phase of the Medicaid rate study has come out. And so we're having a joint informational forum with appropriations on Thursday to discuss that.
Madam Chair, this could be added to the consent calendar.
Wonderful. Seeing no objection, we will add number 6 to the consent calendar. Moving on to number 7, an act concerning a benefits cliff pilot program. Do I have a motion?
So moved, Representative Dathan.
Moved by Senator Lesser, seconded by Representative Dathan. So this, there's been quite a conversation in this building for some time about the benefit cliffs. And we did have a proposal brought to us by
Senator
Martin? Senator Kelly, Martin, a whole team. And so this proposal would look to establish a pilot program to be able to compare the economic and social benefits of addressing the benefit cliff in a number of programs. Any further conversation or question?
No, you can move this to the consent calendar. Madam Chair.
Wonderful. Seeing no objection, we will move item number 7 to the consent calendar. Moving on to number 8, an act concerning nursing homes and implementing the working group recommendations for nursing home wait lists. Is there a motion?
So moved, Representative Dathan.
Moved by Representative Heffernan, seconded by Senator Lesser. There was a working group that met in the summer and fall to address some issues with the current waiting list procedures in the state. If folks remember, we had this conversation last year. The waiting list needed to be done on paper and held in the nursing home by the front desk. And so this working group worked to see if there was a more streamlined way that the waiting list could be done, but also adhere to the oversight that folks wanted. And so we want to hear their recommendations.
This can be moved to the consent calendar, Madam Chair.
Wonderful. Seeing no objection, number 8 has been moved to the consent calendar. Item number 9, an act concerning safety in the healthcare workforce. Is there a motion? Is there a second?
Second.
Moved by Representative Case and seconded by Senator Lesser. As folks are aware, there was a horrible situation in Wyndham where a home healthcare worker was murdered. And so at this point, I will be honest, this is a placeholder bill because we are working collaboratively with our colleagues on the Public Health Committee to understand what recommendations they'll be putting forward. We wanted to introduce a bill because in the conversations we have had with folks in the workforce, there are potentially things that we would need to address through Medicaid. So for example, there used to be a program in the state where someone in the workforce could have an escort go with them, and that was covered by Medicaid. So we just want to ensure that we are also supporting these recommendations. Any comments or questions? Representative Case.
Just real quick, and we had some discussion on this, and so, I mean, it's not necessarily a placeholder because we have language. If public health doesn't come out with the right things that we need to do, we want to make sure that we can follow up and work through it and
Correct.
get some actual action taken care of. So that's why it's in 2 committees this year, because of the need.
Correct.
constraint. So I just want to make sure, and on this side, we'll put that to a consent calendar.
Wonderful. Thank you. Seeing no objection, we will add number 9 to the consent calendar. And number 10, an act concerning non-emergency medical transportation. Do I have a motion?
So moved.
And a second? Oh, well, moved by Senator Seminara, seconded by Representative Case. There have been a lot of conversations and discussions and frustrations here in the state with non-emergency medical transportation. And so this bill will seek to address that. Also, we received a specific recommendation about certifications for those who provide the non-emergency medical transportation, and this proposal would seek to address that as well. Any conversation or questions?
Madam Chair, this too can be moved to the consent calendar.
All right. Any objection to adding number 10 to consent? Seeing none, we will add item number 10 to the consent calendar. Madam Clerk, when you are ready, can you please list off the numbers of the concepts that are on consent?
Yes. Item number 1, item number 3, item number 5, item number 6, item number 7, item number 8, item number 9, and item number 10.
Wonderful. Thank you. Can you? Yeah, she said 5. Yes. All right. Can you please call the roll for the consent calendar?
Senator Lesser,
Senator Lesser, aye.
Representative Gilchrist,
Yes.
Senator Seminara,
Yes.
Representative Case.
Yes.
Senator Gaston, Representative Dathan,
Representative Dathan votes yes.
Senator Marr,
Senator Marr votes yes.
Representative Butler, Representative Comey, Representative Cook, Representative Fortier,
Representative Fortier votes yes.
Representative Heffernan,
Representative Heffernan votes yes.
Representative Hughes, Representative Johnson,
Representative Johnson votes yes.
Representative Kit,
Representative Kidd votes yes.
Representative Leeper,
Representative Leeper votes yes.
Representative Santiago,
Santiago votes yes.
Representative Buckby,
Yes.
Representative Ferraro,
Yes.
Representative Mastro Francesco,
Yes.
Representative Pizzuto, Representative Paletta. Thank you.
Great. Thank you, Madam Clerk. We will hold the votes open until noon. Right now it's 10:22. So folks can vote either by Zoom or in the Human Services Committee. Thank you all so much. We are in recess.
Rep. Johnson.
Hi, yes. Hi, Chandra. Yes.
I need one vote.
Okay. Which one was that?
Can you hear me?
Yes, I can hear you now. Thank you.
Sorry, we had some technical difficulties. Item number 2 on the agenda, which was an act establishing a task force to study the need for adult changing tables in public facilities. How do you vote?
Yes, thank you so much. Is that the one I missed?
Yep, just that one.
Okay, thank you very much.
Thank you.
Talk to you later. Bye.
Hello, how are you?
Good, how are you?
I'm good. Sorry about that. I'm just getting to my office.
You're good.
Okay, yeah, how many things I missed that I need to vote on?
So we have a couple that need to be taken by roll and then the consent calendar. So
Okay,
first one is item number 2, and that's establishing a to study the need for adult changing tables in public facilities.
okay, so I want to vote consistent with the chairs on this. I remember this coming up the other day. It's an interesting concept, by the way.
Yes.
Okay.
So how do you vote? Yes.
Yes, I vote yes.
Thank you. And then item number 4 on the agenda, which is an action starting a working group to study extending health benefits to all persons under the age of 19.
Okay, yes.
Thank you. And then last but not least is the consent calendar, which is every other item but those 2.
Yes.
You're all set.
Thank you so much. I appreciate it.
See you later. Representative. Hi, hope you're on mute. Still on mute.
All right, here we go. I'm good.
Good. All right. This will be quick. So the only thing that needs a roll is item number 2 on the agenda, an act establishing a task force to study the need for adult changing tables in public facilities. How do you vote?
Okay, I'll be no on that.
Item number 4 on the agenda, now concerning a working group to study expanding Husky health benefits to all persons under the age of 19.
Yes.
And then the consent calendar, which is all items except item number 2 and 4. How do you vote?
Yes, I'll be voting. It was that item.
Oh, sorry, you want to mute.
Sorry, I'll be yes on the consent calendar, but the item before, was it number 4 or 5 that I voted yes on?
4.
And what was the title of that again?
An
I'm sorry.
act concerning a working group to study expanding Husky health benefits to all persons under the age of 19.
Okay, you know what? Let me change my vote to no on that one. I for some reason I had flagged number 5, but I'll vote no on that one.
Number 5 is on the consent calendar, so I'll change
Got
my
it.
vote to no for number 4.
Okay, thank you so much.
See you later. Take care.
Bye.
Bye. Hi, Representative. How are you?
Good. How are you doing?
Good, thank you for asking. All right, well, let's get into it. I won't take up too much of your time. So the only two items that needed a roll call vote were items number 2 and items number 4 on the agenda. So the item number 2 is an act establishing a task force that study the need for adult changing tables in public facilities. How do you vote?
Yes.
Thank you. And then item number 4 on the agenda, which is an act concerning a working group to study expanding Husky health benefits to all persons under the age of 19. How do you vote?
Yes.
Thank you. And last but not least is the consent calendar. So that's every item but number 2 and 4.
Yes.
Awesome. Thank you so much. You're all set.
Thank you.
Take care.
All right. You too. Bye-bye.
Representative. Hi, Representative, can you hear me? Okay. Oh, you're on mute.
Mute. Here we go. How about now? Can you hear me?
Yes, how
Thank
are you?
you. Good. I just wanted to vote. My votes are the same as David Tigliano's, and we compared them. So if you could put me down exactly how he has.
So Representative is not on this committee. This is Human
Oh, I'm
Services.
sorry.
That's okay.
Is it JK?
Can I just go over them with you real quick? Yeah.
Sure. Yeah.
Okay. So we have item number 2 on the agenda, an act establishing a task force to study the need for adult changing tables in public facilities. How do you vote?
No.
No. Okay. Thank you.
2 and 5 were no's. This is, I'm gonna make sure I'm on the right one here. Was it, is my chair?
So yes, number 4 is actually the other roll call. Number 5 is on the consent calendar. So item number 4 is an act concerning a working group to study expanding Husky health benefits to all persons under the age of 19. So you're voting no on that?
Extending health benefits, yes. Yeah. Yep.
Okay. And then last but not least is the consent calendar.
Okay. Yeah. And so thank you very much. I really appreciate it.
All right. Thank you. Take care. See you later.
Thank you.